Candidates who are applying for residency. I do not have any conflict of interest to disclose, but I will say the talk is tailored more towards international medical graduates. And then anything I discuss today is reflects my personal views and experiences, and it does not represent any official policies, views, or endorsement from University of Washington or its affiliate institution. So information provided is intended for education purpose only. I If you can put in the chat which residency specialty you're applying for or plan to apply for, you don't have to scan the QR code. I drafted this so that if we have a huge group, then I'll get a sense of what specialty people are applying to. But feel free to put in the chat if you feel comfortable. If not, even that's fine too. So today we'll be talking about preparing for interview, mastering some of the common questions asked in the interview, participating in, practicing. Practicing is the key to success, effective communication during the interview, highlighting some of the uniqueness and strengths of IMGs, preparing questions for your interviewer, technology preparation for the interview, building some of the confidence and handling interview stress, and reflecting and following up post interview. Some additional tools, if we have time, about self-awareness. So let's get into that. So why interview skills are important? Because it's very important when you apply for a residency match, your first step is you get that interview. So it's already a huge thing. Congratulations if you have received interviews. And it's a huge thing because the program has already vetted all the applications they received. They have some of the filters that they have, year of graduation, any failures in steps, and after that they review all the applications or most of the applications that they can, and it's a holistic approach. So once you're in the interview, that's your chance to make an impression. And it's mostly nowadays 20 or 25-minute interview with one person, and you interview 4 or 5 people max. So making that impression on that day is very important. So um, definitely preparing for it. What's the unique challenges IMGs face is the language barrier. Most of the time, you see, I have an accent. English is not our first language, so sometimes that's where we have to practice a lot. Cultural differences, some things to think about, what to say or how to. Especially back when I was doing interviews, you're doing it in person, so there are a few things, how to address someone. Mostly in US, you address everyone with last name if you don't know them, and first name if you're more informal with them. Unfamiliarities with US medical system are also something that puts extra challenge for IMGs when they're interviewing. So learning more about that on your own, understanding what the system might look like. And the goal is to equip some of the candidates with the strategies to present themselves confidently and navigate common challenges and ace in interviews. So let's get into that. So research the program. The program you get interview from, they have already done review of your application. So before you go into interview, I would highly, highly recommend that you know the details of that residency program, and you're interviewing whom you're interviewing with, what their program's mission is, values, specialty focus. Gather information from program website, alumni, or residents. Reviewing your own application is also important. Know what's there in your CV, in your personal statement, achievements, inside out. Because if I'm reviewing an application right before I go interview a candidate, I can ask very specific questions. So you mentioned about an internship in pathology or internship in something else or a volunteer work they have done. So they should be prepared to talk about that. It might be a talk you have given or oral presentation you did, a poster presentation on a topic. So we can ask questions about that. Be ready to discuss specific experiences, so clinical rotations, any research work you have done, any volunteer in detail. So know you know what you're doing. The worst thing you want to do with yourself if you have an oral presentation, let's say, for example, I'm in transfusion medicine. So if someone says they have done an oral presentation on thromboelastography or viscoelastic testing, I know too much about that. So if I start asking questions to someone who may not know much about it, it just puts them in a wrong impression for me because I feel if they have done an oral presentation on something, they should know better about it. So if whatever you're putting on your CV, be very careful about that. Understand the US residency culture and system. So very basic differences in residency cultures or hierarchy compared to other countries. So for example, I'm from Pakistan and pathology in Pakistan is very different. So if someone is applying for Pakistan and if I'm mentoring them, I ask them, what do you know about pathology in the US? So I'm expecting they should know it's a 4-year residency program, it's APCP, what's in AP, what's in CP, how boards are different, what to expect afterwards. There's fellowships. So all those differences. And then what's a resident, what's a fellow, what's an attending, what level you are, how long is the residency or fellowship. Expectation of professionalism and communication styles in US, it's very important that you communicate very closely, even for future when hopefully when you get residency, be very vigilant and mindful about close communication. If I have a resident that I'm expecting on service and they are not showing up at 8 a.m. or they're running late, I really appreciate an email or a text from them that they're running late. So those kind of very small things, count. Um, so I wanted to just have think to yourself, how would you describe your preparation for residency interviews so far? If you're in that cycle right now, you're interviewing in 2026 to 2027 cycle versus next year cycle. If you haven't started preparing yet, start soon. And if you feel somewhat prepared, then practice more because that's gonna help you. So we're going to talk about some of the common interview questions. So personal introduction, that's very important. I actually, even after I review applications, I want a person to tell me about themselves. I introduced myself, for example, before we started this seminar. So tell me about yourself is a very common, simple question where I'm trying to understand you. Let's say even without reviewing your application or CV, what do you want an interviewer to know about you? And that's your chance to talk about anything that's unique to you. So crafting and engaging, tell me about yourself, is very important. I would highly recommend you put it down in a paragraph and actually start practicing it before you go into interviews. Your own background. I'm originally from Pakistan, or which year I graduated, which what sort of internship or clinical work I've done after that, relevant experiences in you have done a residency in your home country or you've done an internship in what specialty, your personal story, how you made it there, what different um, places or locations you have lived in, what different cultures you have interacted with. Concise and focus, and it may be up, it can go up to 3 minutes, but like I said, you have 20 minutes for an interview nowadays, or 25 minutes max, or 30. You want it to be between 2 and 3 minutes, and it you can go 4 or 5 minutes if you want to, but your story has to be very interesting for that. So it's all about storytelling. Like, what's your story, how you want me to imagine you as a person, and be very authentic. I think that's your chance. Whatever is not in your CV is to talk about. So I can tell you, programs have a list of things they cannot ask or talk about. So I cannot ask you about any of your personal questions. But if you come up and start telling me, oh, your significant other is also planning to move to this city and you're very interested in this program, or they're doing this, or I have a kid who's going to start middle school now and I'm very excited and I think it's a good transition time. Anything like that, which is not in your CV and very personal to you, it's perfectly fine for you to tell that, but an interviewer cannot ask that. So something to think about, anything about your story that did not make it to CV, but you want to tell the interviewer, this is your chance to tell that. And for me, for example, when I was applying for interviews, my daughter was 3 at that time, so I was very open about talking about being new mom and navigating through new system and a lot of new things and all that. Your hobbies and interests, of course, I think everyone, especially given you'll be going to a program and staying there for 4 years, when we are interviewing someone, we want to know, what their interest is as a person. So we want to know you as a person. So talking about, your your academic achievements and your clinical work is very important, but then ending with what you like to do outside of work is also very, very nice touch to your personal tell me about yourself question. So any hobbies you like cooking or you like hiking, painting, dancing, anything, that's your time. Then behavioral questions. So for this, I recommend using STAR, which is situation, task, action, and result method. So examples, most of the time, that's where we are trying to see as an interviewer your thinking process and mostly a mature thinking process, how you approached a situation, how you handled it or resolved it. So most of the time, questions can be tell me about a time you faced a challenge in clinical setting and how did you handle it? Or tell me about a time you made a mistake in clinical settings and how did you handle that? Time you disagree with a colleague or a supervisor or a superior, you went above and beyond for a patient or colleague and what motivated you? Or describe the time when you worked in a team and what was your role and how did you perform in the team. So all of these is mostly looking for how you approach a conflict or challenging situation and what's your thought process. So for me, I really like when interviewers have a very clear-cut, clean story and good vision of what they do and how. So, for example, some candidates start with my approach is to start with the communication, and I can tell you when I was a first year medical student or taking me to that point where they had the conflict and then telling what was their role. They were first year medical student and they were working with a team where they had people from different specialities. So all that builds up to that whole situation. What was the situation and what was their task in that whole teamwork, and what action was needed or what the conflict was and how did they approach it and resolve it. So think of I always tell your conflict or your challenging situation does not have to be in a medical setting. It can be outside of that. I have candidates who answered excellently on this with a story they had outside of work with a group of friends. They were going out where they had to decide between helping a stranger versus attending a friend's birthday, and what did they decide to do and how did they approach the situation, or what did they did in a challenging situation. All an interviewer is looking for is your thought process, how mature it is, how you approach different situations, which certainly can arise in residency as well. So make sure to prepare for that. And one of the things sometimes people ask is how do you manage multiple responsibilities and deadlines, and how do you prioritize your day? So mostly same. You don't have to have a story, but you can tell, in med school too, I started doing that because all of us go through med school and it's very busy, and you have to have a process how you manage your week, a day, and even like small task. So some of the buzzwords or keywords you want to think about is how you triage your day, how you put it down in a Outlook calendar, or you have a diary you follow, or you what method you follow to follow your day. What do you analyze out of that list? What things need priority? What tasks are going to take longer and what tasks are faster? How do you communicate that? And how do you manage your deadlines? So very important in residency, for sure, which is also very busy and a lot of on call. So understanding, how you have a game plan for that ahead of time is what interviewer is looking on an interview. Okay. So I already talked about this, but what is the interviewer aim? To learn about the candidate through all these behavioral questions is navigate, how they navigate through conflict or stress. How do you handle a stressful situation is also very simple, straightforward question. What's your emotional intelligence? Like, how aware are you of your own self and your surrounding? Uh, what's your communication skills? So practice, practice, practice. If you have a story that you want to tell on an interview, and it can be same story. Interviewers may not be talking to each other, or even if they are, if it's the same story and that's the significant event you want to talk about, it's okay to talk about the same thing, but practice so that you're talking in a nice flow, with right pauses at the right locations and right amount of stress and information. And it should be a story which is interesting for me to hold my attention. Adaptability to challenging situations. So that's your chance to show that accountability and integrity, time management, teamwork, professionalism. So all of these, these kind of questions are looking for some of it. So how you're drafting your answer definitely shows you as a person how accountable you were in that situation, how you resolved it, how you approached the team afterwards, what's your professionalism, like did you follow up on something if it was needed, that kind of small thing. Then clinical scenario questions. So some programs also like to ask some clinical scenario questions. So most of the time what it can be a hypothetical clinical case or problem solving question. Most of the time they're looking for decision making skills, resilience, dependability, and ethics. For example, if you're in pathology and you get 10 frozens at the same time and you're the triage resident that day, how will you handle that? So it's a very tricky question. They want you to handle all of it, but at the same time, know when to ask for help. So for me, if I'm that resident right now, and now that I know what to do, I would say I would triage and see which ones need to prioritize, but I can tell I cannot run 10 frozens at one time. So I will ask for help and I will call my colleagues and my fellow. And then, so going above the steps, how will you go that you ask your colleague residents and then fellows and then attendings, this is the situation, what should I do? So call for help, when to call for help is also very important. Um, Decision making, that shows decision making. So resilience, you're gonna work as a team, and make sure all the results go out in real time, and it's gonna affect patient management and patient outcome, and people can depend on you, so that that yes, you have developed the skills to do so many. And let's say you're a first year resident versus second year resident, you're going to have different skills. So having that insight or emotional intelligence, that let's say if I'm a first year resident, I may need more help, but when I'm a second year, I would be faster, I think, and I would have more practice by then to do all these frozen. So depending on my comfort level and how small or big the samples are to do that frozen, I will go ahead and ask for help. You have PAs as well, physician, pathology assistants in gross room. It can be any other clinical scenario as well, but what they're looking for is your decision-making skills, your resilience and dependability, and how you would approach a actual clinical scenario. Okay. Difficult questions. So handling tricky questions such as gaps in education, any low scores or personal weakness that they pick up on your CV or on your application. It's something very important that you are prepared to discuss. If you have any gaps in training or experience, with honesty and focus on how you're addressing them. For example, when I moved to US from Pakistan, understandably, I did not start working right away, and I was a new mom too. So it took me at least 3 years to start doing that. But what did I do in that time was very important. So I started explaining that I picked up a remote project in with a team in Pakistan. I started reaching out to others, universities or clinical uh, teams for projects, or I started doing some volunteer work. Any research experience, anything you have done in between to cover those gaps, or it can be a gap because of personal reason. I was going through a lot. If you're someone who was taking care of a loved one, or going through any any health issue yourself, that's your chance to talk about it because it may not make it to your CV. Discuss the skills you gained from practicing in diverse healthcare settings. So one thing I was asked, oh, you're coming from Pakistan and you've done this internship or house job in Pakistan in internal medicine and you're applying in pathology, but that showed diverse healthcare setting experience. And I sold it in a way, which is very true, that it does help. It's going to help me become a good pathologist, knowing what's happening on the clinical side. And I really wanted to do that, even knowing that I want to go in pathology. So all these things add up to how you present yourself, how you present those things that you have done in the past. Frame your weakness as learning opportunities as well. One very straightforward question sometimes can be, tell me about a weakness you have. Um, Most of the time, I always think of you want to pick up something that, for example, I'll give my example. I do get, even right now, I think I have this issue that I can get fixated on things. So I worked on it, and especially as a new mom or as a mom in general, I have to let go of that. So you cannot be doing that. And just having that insight that you have some sort of weakness that you think affects you, and how you ground yourself and how you identify it and work on it is more important than what it is. Okay, so make sure you present it in a nice way, and in reality how you're actually managing it. Questions for the interviewer. So one thing, most of the interviewers do say, "Do you have any questions for me?" And this is, I over the years I realized how this has been something where interviewer can the when you're interviewing, you can make a very different impression on the interviewer. If a candidate answers, "No, I know most about the program and I don't have any questions," it's perfectly fine. But then that was their chance to make some impression on when I'm interviewing or anyone is interviewing. So what can you draft as, uh, do you have any questions for me when an interviewer asks that? So avoid asking about on information that's already on the website. Most of the time people say it in a way, "Oh, I already searched your program and I think I know a lot about the program and I've interacted with residents on meet and greet." So they start off with this sentence sort of telling me they know about my program already or they have researched on it. But if you're interviewing with a resident, ask how their typical day looks like. Okay, that's not a question for an attending or PD because their day looks like very differently. So for residents, a good question is how their typical day looks like in or on different services. It can be a question for attending who's interviewing, asking or drafting in a way, what is expected of a resident when they're rotating on transfusion medicine. So I'm on transfusion medicine. I introduce myself that, and if someone is asking me exactly that, I think they're preparing themselves to come into my program and want to know how or what I expect of a resident when they're on transfusion medicine, which is a good question. Ask attending about something specific about the program or the city. So if you don't know much about the attending themselves, what their specialty is, most of the time I like specific questions. If you are interviewing with someone who is in renal pathology, ask a renal pathology related questions. They like that more, of course. But if you don't know that, ask anything about the city. So what's I think one few of the good questions I have received is, I'm in Seattle, so what's the best thing about Seattle that you liked so far? Or what's one thing you'll tell about Seattle that I should know ahead of time? So drafting how you draft your question, but I think it's a good question. It shows your interest in the city and in the program that you want to come there and you want to know more about it. Or if you have been to the city, you can draft it. So I've been to Seattle and it was wonderful, but I've heard that winters are like that. What's your take on it? That kind of thing. So very specific. Ask about program improvement or specifics or strengths and carefully draft that question. So you can also ask if there's anything specific in the program that you would like to change or you think should be done differently. That was also a question which is very interesting and intriguing for interviewer. The strength of the program, we generally, when you're in an interview, we generally think our program is very good and we are selling it. But if you want to ask someone, you can ask, what do you think is the best part of your program? I think your program seemed very comprehensive on the online information and on the website, but I wanted to hear from you, that kind of thing. Tailor the question to the interviewer's expertise. I already talked about that. You can do that, and that shows a lot of interview preparation that you know your schedule and you know whom you're interviewing with. Be mindful of your interviewer. So if you're interviewing with program director, associate program director, or the coordinator, they have a huge say on who should make it to the list of ranking and who should not. So be very careful what you talk or when you're talking to them on an interview. Any additional thoughtful questions to consider? Those would include about mentorship. So, does the program have anything where where you as a resident can have a mentor? That's a very good question to ask, I think. Anything about clinical experience, so you can ask about, oh, I saw you, the program has a lot of fellowship options, and I was hoping to explore more about this fellowship. So can you tell me more about that? Opportunities for any research, teaching, quality improvement, or QA projects is also a good thing to show your interest in pathology. Pathology is full of QI and QA projects. So any training coming into that, interested in quality improvement, we definitely appreciate that. And anything related to your future goals that you're interested in teaching. So are there any opportunities of teaching in your program? So for example, our different programs uh, have some other medical lab scientists or undergrads or medical students coming through the program. So residents do the teaching for them. So knowing that ahead of time can be helpful, and it shows your interest in teaching. So journal tips, how you craft your question is important. So craft it ahead of time. Be genuine. Ask about things that you truly are curious about. Demonstrate your goals. Tailor your question to show that you have thought about your future and um, how are you looking for the program that aligns with your goals, and stay positive even when asking about improvement or challenges, or phrasing that question in a constructive manner can keep the conversation positive. Okay, so what aspects of residency interview do you find most challenging? So when you're preparing for interviews, think to yourself which part of the question is something you're worried about, because that's where you want to focus on. You might know, you just have never thought about it yourself, that which part of this questionnaire, because sometimes people think, oh, interviews are low key, just behavioral questions, I'll be fine with that. But then think about things, where you think you should work more. For clinical scenarios, for example, I prepared for an interesting case, and I think I was asked that during interviews when I was interviewing, tell me about an interesting case you saw in pathology. So be prepared for that kind of thing. Practice, practice, practice. So, one thing, English, I already mentioned, may not be your first language, and even if it is, it's very important to practice for the interview. So, importance of practice is that practicing responses. Um, um, it's very crucial, especially if English is not your first language. And the suggestion is that you practice with a friend, mentor, or record yourself, and that will help you refine your answers and improve fluency. Okay. Mock interviews. So definitely, I have done mock interviews with trainees, and it helps them, because once I was interviewing someone and I asked something very generic that I asked most of the candidates, and he just got confused, and he was like, "Oh, sorry, I think I should prepare on this much more," and it just gave him good sense of what to prepare for. Most of the things I'm already talking about, but think of these questions and go prepared. Even if you think you know what to talk about on your strength, generic questions, what's your strength, what's your weakness, where do you see yourself in 5 years? Draft an answer and practice it too, because that will make you more fluent and more confident when you're answering. You're not making up things or drafting your answer right at the go. Um, for example, right now I'm speaking with my thought process more than prepared on this with just some slides. So I'm also picking my words, what to talk about, what English word fits best over here to explain something. So that kind of thing slows me down, and you can already tell, um, I'm going, I'm talking as I go. Versus if you're someone who is prepared very well on something, it speaks more fluently. It just flows much better. Consider practicing in mock interviews, and then tailor your feedback, body language, clarity of speech, overall confidence when you do these mock interviews, and you can do them with your friends as well, who can give you some feedback. So practice, practice, practice. I think that's the key. Um, some of the effective communication skills during interview, non-verbal communication. So even if you're doing it on Zoom, make an eye contact, maintaining a good posture, not, hanging back in your seat or things like that, using appropriate hand gestures, active listening, so engaging the interviewer by listening carefully. So if I'm asking a question, and it's not clear, it's okay to respond back by, can you please repeat your question? I want to be sure that what I heard is exactly what you're asking. So the interviewer might rephrase the question, but do not start answering if you have not understood the question completely, because that offsets everything. Because you would be probably completing your answer, and the interviewer said, "That's a good answer, but I this is not what I was asking," and then it's not a good situation. So listen carefully when interviewer is asking some questions, and engage the interviewer by listening, and pausing to reflect before answering is also a good way of communication. If you're thinking of a situation, it's perfectly fine. Once in a while, I had someone who kept thinking, but they could not pinpoint an event that they want to talk about of conflict resolution. And I felt they never prepared for it. And they end up saying, oh, I never was in a conflict. I'm like, it just seems humanly impossible that if you are someone, living in a society, that you never faced a conflict or a challenge that you resolved or you approached differently. Language confidence. So speak clearly and at a moderate pace. I speak very fast and I get that response from students, and I try to slow down myself when I'm doing teachings, that I should not speak that quickly or fast as I typically would. Don't worry about your accent. So I have an accent. Focus on the clarity, focus on what you're trying to communicate if it goes through. Do not worry about your accent. It's more about if you're saying it in the right English, and if your flow is good. If you're unsure about a question, I already said ask for clarification. This shows professionalism. Okay. Technology preparation for interviews. So before you go into interviews, especially nowadays, if it's a remote interview, ensure that test that everything is working. Your internet connection, your audio, your video settings, backup devices, hotspot ready, everything, connectivity. You should be very ready. Setting up your interview space. So what's on your background? Do you want to blur your background? If someone is expected to walk behind you, that distracts the interviewer. If you plan to have something in the background, like a bookshelf or anything, I would recommend keeping it very brief, or less crowded. So a quiet, well-lit space for interview, dress professionally, and avoid distracting backgrounds. Okay. Uh, Let's see. Building confidence and handling it. So interview process is very stressful, and I know that I've been there. So focus on the present moment. You got that interview. That's in itself a huge thing. Congratulate yourself on that. Be happy about it, and focus on the goods. The preparation is the key. If you're prepared, then don't worry, don't hesitate. You won't hesitate too much to say what you're gonna say, because you have prepared so much to what you wanna say. So do mock interviews before you go into interviews. Positive self-talk, reminding yourself of your strengths and achievement. We all go into imposter syndrome. We feel we're not good enough to make it to this or get into that. Please do not do that. Remind yourself of how you went to med school, how you graduated through med school, and how many years you have worked already. Focus on the good things that you have done so far and you've achieved despite all the challenges and hurdles that you had to face. And it can be very different for different person. There is no race. Every person has their own path and own destiny. You're just following that. Pacing and pausing, speaking slowly, pause to think, don't rush your answers is perfectly fine. Self-care, get enough sleep before the interview, stay hydrated, take time to relax before the interview. If you're fidgeted or you're stressed, then the interviewer can sense that very easily. Now that I've interviewed more than 100 people, I can easily tell this person is very relaxed in themselves, how they're talking, versus who's very active and vigilant and super worried about it. They just are very anxious. Reflecting and following up. So once you're done with the interview, it's a done process. Okay, you prepared for it and you're done with it. Now what to do afterwards? So do take notes. Keep a notebook with you. It's okay to take notes, especially when someone asks me a question, when I give them a chance at the end of the interview. Okay, do you have any questions for me? And if they ask a very specific questions, about a fellowship or about the program and they're taking notes, it's perfectly fine. Um, you can take notes after the interview as well if you have breaks in between to note it down. You will forget it later. I can assure you that if you don't note it down anywhere in a month, you will have interviewed if three or four different places. You will not remember what you talked about or what the other person responded from which program. So I made notes, especially under different program names that I was interviewing, so that if I go back and I'm ranking them, I know what I talked to them or what was the responses I received. Sending thank you notes, this is optional now. I have had mixed responses about this from different faculty. I'm a faculty myself, and I've been associate program director. It does not change much on the ranking. It does show a very strong interest from the interviewer. I would say if you choose to send a thank you note, it's perfectly fine. Um, they're not very time consuming for the sender and for the receiver. It's a nice gesture overall, but make it individualized and minimal impact. I already said that it's minimal impact on ranking, but it's not a make or break factor. If you do send it, keep it concise, sincere, and personal to avoid overwhelming. We get a lot of emails as faculty and as attendings working in pathology. So if I'm receiving a thank you email, I and reading through it, I'm almost skimming through it quickly what the candidate want to say, and I'm seeing if they're asking, because I always say if you have any follow-up questions or any questions that come up later, feel free to email me. So I'm also looking if they had any additional questions that I was not able to answer or discuss in that 20-30 minute that we had, or what are they trying to say. So keep it concise, do not go too detailed or too long. And then if it's very personalized, it's much better. Like if someone had a discussion with me about transfusion medicine and they're talking exactly about that, then a generic generated response as a thank you note, it does make some difference. Additional tools for self-awareness. So, like I said, everybody is going through this stressful process and double questioning themselves, thinking about how to prepare. So personality assessment, these are all optional. These are all outside of interview preparation or or residency. It's just, I think, a personal or career development skills that I wanted to discuss. So I do encourage uh, candidates to think about taking Myers, Briggs, or Saboteur assessment. It just gives you some insight into your own strength and potential areas of improvement. It can be used as self-awareness and it improves your interviewing skills overall. So understanding yourself, it helps tailor your interview style and response. For example, the Meyer-Briggs type indicator, so MBTI, it tells you if you're an extrovert versus an introvert, or if you're a judging or a sensing or a feeling. How do you approach different scenarios? So let's say I'm an extrovert, so I'm perfectly fine talking to people for a long time. But if you're an introvert, it may require you a different sort of energy and different sort of environment to feel comfortable to talk to someone. So knowing yourself helps you, yes, this is something you're doing outside of your comfort zone, and how do you get comfortable with it? By practicing or by thinking about it ahead of time, that how everything is going to span out. Saboteur. So saboteur assessment is these are some of the traits that we all have, and it's very interesting. When I got to know about saboteur assessment, it's online assessment. You can search about it, and you can take these questions, and they give you this result at the end. It's free of cost. It's different traits we all may have. Like if you're an avoider, or you're a hyper vigilant person, or you play victim a lot, those kind of things. So it will give you a result like this. Oh, you're a hyperachiever, or you pleaser, you're a controller. So for example, questioned, I saw someone and they were hyperachiever, and I was like, if they're not hyperachiever, they would not make it to where they are. How can this be a saboteur or a bad thing? And I was told that how when you're a hyperachiever, you oversee yourself and you overlook your own self health and integrity, and sometimes you're too focused on getting to what you want to get, And in that, that fixated personality or something where you may be missing out on a bigger picture. You're too focused on something small. So that kind of thing, knowing yourself. If you're a people pleaser, knowing you're a people pleaser helps you because that's a very good insight to have where you're like, oh, maybe I do that a lot and maybe I need to stop it for some people and okay to do it when it's needed kind of situation. If you're someone who plays victim a lot, that, oh, I've been through a very hard time, it can also be a good insight for yourself to know that no, I don't want to play victim. I think I've come above and beyond of my challenges, and mm, I I may not think of myself as playing victim, but if that's what the scoring is telling you, it just helps you having that insight. Are you doing it or not? And I will say I've heard it changes over time. So in 5 years or a decade, if you take these tests again, it will change, which is good, which is sign of growth. Explore all available online resources and read on these topics. It's very helpful. There are papers out there on challenges for IMGs in US graduate medical system. Having that just very simple read on these papers on prevalence of US trained IMGs, it helps you. It's very encouraging, actually. All these papers, when I read through them, I was like, okay, here, IMG contribute 23% of the physician workforce in US. It's not a small number. 23% of the US workforce of physicians, they have physician shortage in some of the areas, are international medical graduates doing all that work. So go and search for these resources. You'll find many different. AMA has a lot of resources on these. There's other platforms that might have more things about it. So just to recap, preparation, practice, self-awareness are the key to successful interview. You want to be prepared, and how will you prepare for it? You gotta practice, and you want to know more about yourself before you go into it. If you're worried about something, address it ahead of time so it doesn't show as anxiety in real interview. It's a very small time to prove yourself or show yourself. And if you're someone whom I'm enjoying a conversation, I put a scoring right after an interview, and that goes into the candidate. So if a candidate is really good on paper but was not able to have a good conversation for that 20 minutes, will lose that score in when the interviewer is scoring them. So that's the last thing you want to do. I would like to thank everyone who was able to attend today. I would really appreciate eval. This will help me improve. I did this last year as well, and I want to know more how I can improve on this and what you may be looking for, or if this was helpful for you, because it makes me feel satisfied and keep doing this every year if it's helpful for the candidates to go over this sort of thought process. Thank you so much. I'll open the forum for any questions. If someone wants to come on camera or unmute and have any questions, we can take that. Let's see. Right, you're most welcome. Okay, with no questions, I think we can end the session here. Thank you all who took the time out to attend. I hope it was helpful. Uh, Feel free to reach out to me or any of the people if you're applying in pathology. There's different platforms as well. Uh, for people who are doing a lot of mentoring and helping candidates, I sometimes I can't do too much, so I always always have one or two candidates that I'm mentoring. But find a mentor for yourself. That's my bottom line. It doesn't have to be someone you know. You can reach out to anyone in a community hospital or who is already attending to help you review your application, to help have a mock interview with you for just 30 minutes, and that can be very helpful. How to answer questions about why our program and why you? Yes, that's very good question. So I do ask this, and what I'm looking for is they know about my program or not. So for example, um, if you're applying to a community hospital pathology program, a smaller one, you want to say, oh, I'm interested in your program because it's in a urban or a setting where it's gonna be less people and smaller group and more one-on-one working. Versus if you're going in a larger program, you tailor your answer towards them, saying, I want to be in a bigger program, in an academic program where I can have a variety of cases or more cases to look into and learn from that. So tailor your answer towards the program which asks you this question. If it's a program that's a very new program or it's a program which is a community hospital in a remote area, make sure you answer something that fits with them, that shows your interest of going into their program and why you mostly it's almost like selling yourself and don't feel shy of that. Be humble at the same time, so it's a very fine line. Mostly I've seen candidates say, I don't want to say too much good about me, but I am someone who's very passionate about pathology or XYZ, and I've been working so hard to be where I am, and I think I'm gonna keep working, and I think I'm gonna be a very good team player and a, a, a a good fit for your program. So something that you think is a good quality of you to put it out. Don't be shy of that. If you're someone who has leadership skills, you say if someone who has teaching skills in the past, if you're someone who has done a lot of research work, then whatever it is that makes you unique or someone which fits that program or where it fits with the program nicely is what you want to answer. And definitely tailor something depending on the program you're interviewing. So for example, I am at University of Washington, which is a huge program. And I had a candidate say they have not worked in a big program like ours, and for me, that was slightly concerning. Like when I was putting an eval for the candidate, I did say they have not worked in a bigger program like ours. Versus if that candidate would have drafted their response in a way that they're looking forward to work in a bigger program like ours to have more experience, that would have been much better answer than putting that kind of weakness in front. So be very mindful of what you say. That's why I emphasize throughout this hour that you gotta practice. You gotta practice ahead of time. So you don't say these kind of very small points that interviewer can pick up as like a concerning thing for a candidate. So I did put, for example, if I'm putting a scoring, I can put a comment and say, they've not worked in a bigger program like ours, so on-call volume may be too much for them, or it might be something that it can take a steep learning curve for them to get adjusted. So those kind of things for you would be very important to know about the program ahead of time. Has no clinical gap, and I have more than 8 years of clinical gap. Um, I don't know how I will address that. I was raising my kids and volunteering in community and just 3 months observership. Any advice? My advice would be uh, you can be very honest about that. And if you got the interview, that means they picked up something on your CV that fits well with them. So they are interviewing you. Otherwise, they would not have interviewed you. If they are interviewing you, just be at peace at least that there is something in your CV that they're looking for and you have it. Okay. The 8 year gap, you can address it yourself by when you're introducing about yourself, saying, um, I acknowledge that I do have a 8 year gap in my CV, but in that time, I was going through a rough patch. I new mom and I was raising kids, and my husband was working full time, and we as a couple or as a family decided to focus more on the kids a little bit before I can go back to work. And I did try and picked up a lot of volunteer work and talk about the volunteer work you've done. So you've already said about your hardship, but don't go too much into that. That's the fine line. I would stop there and then go into, because everybody, we all are humans. A lot of us have families or have siblings who have families or have niece nephews. They understand how hard or how much work goes into when you have a kid. So, so explaining, why you have a gap is what they might be looking for. And if they have, congratulations. In fact, if they have extended an interview to you, you have something in your CV that stood out for them, and they, if they're interviewing you, it means they want to rank you as a candidate who can match. All you have to do is just be confident in what you're saying and how you put it out. Okay. So draft a response for yourself, practice it with someone, and modify it, uh, or edit it to a point until it sounds very sane and real, honest, and visionary. You can say how you had the vision and you always felt you were holding back because of a lot of you know family constraints, or what was happening outside of your control. So saying these kind of small things will make an interviewer understand that there were hurdles that were slightly outside of your control, but you were still trying. You always wanted to go back. You knew that. And that's where you were working on other things to get into, back into the clinical field. I hope that answers your question. Okay, we have 2 minutes left. If anyone has any last question, this is your chance. But thank you for the opportunity. Thank you, Peace, for arranging this. I hope it was helpful. All right. Have a nice rest of the day. Bye.